Yeah, so in terms of the vaccine, this is a third generation smallpox vaccine, live attenuated, not able to replicate, that has been studied and approved by Health Canada and the FDA in 2020 for the prevention of smallpox and other orthopox viruses, including monkeypox. We have data on safety on over 13,000 doses, 7,000 patients that were enrolled in studies. What we know is that the vaccine is able to prevent smallpox, is able to prevent in animal models monkeypox, and is also able to prevent monkeypox in animal models when given after a lethal dose of virus was administered to the prairie dog. So we have various data that supported this authorization of the vaccine. And so what the Quebec Immunization Committee did was just to focus on what group of patients should be allowed to be vaccinated in the current context. This is an interim recommendation. NACI will have their recommendation out in the next few weeks, and depending on what is in that recommendation, we might modify ours.
With this vaccination, it's being given to people who are, or will be given to people who have been in close contact with confirmed cases. What's the window for someone to be vaccinated between exposure to the virus and between when they really develop the virus and it's too late?
So data have shown that if you give it within 4 days, you have a very good effectiveness in preventing the illness. If you administer it between day 5 and 14, it might not prevent disease, but it might modify the evolution. So the recommendation is really to aim to give it within 4 days post-exposure, with some flexibility up to 14 days. And if the contact has been continuous or intermittent, we are giving a window period of 4 days after the last exposure.